Hey everyone. Today I wanted to take a few minutes, and I hope I can make this quick, but I wanted to make sure and cover a bunch of important stuff, so stick with it if it interests you. I want to talk about wellness care or maintenance care. Now, for any chiropractor or fan of chiropractic as a patient who's been at it a while, you've probably heard the objection or the question, honest question from folks about, once you go to a chiropractor, we all want you to keep coming. Something related to the fact that there's going to be the recommendation for wellness care or maintenance care or supportive care. It goes by a bunch of different names. We call it wellness care around here. But the idea being that once you put in the work of some real restorative care to get you over your injury or your concerns, health concerns, let's maintain it. Let's keep things moving in the right direction so we achieve some real wellness here. So I went looking for studies and surveys and articles related to that. And I got two great ones here that I want to touch on. So let me just jump right in. Let's start with this guy right here. The title is A Theoretical Basis for Maintenance Spinal Manipulative Therapy for the Chiropractic Profession. So this is a fella who searched PubMed and plugged in relevant terms and basically gathered together a bunch of different information, and he's presented it, things related to the benefits of wellness care and why it's not good for a subluxation to stick around for more than 30 days is what it amounts to. So he makes the point that just like I've been saying, that it's a common recommendation by chiropractors in the U.S. and in Australia to recommend adjustments as part of wellness care. As a matter of fact, it's over 90% of chiropractors, he says, recommend it. And as a matter of fact, 97% of American and 85% of Australian chiropractors use the adjustment as part of that maintenance care. And the idea is it's generally recommended to minimize recurrences or exacerbations of conditions, and 90% will say also to optimize health in the patient. Remember that. I'm going to circle back to that as far as minimizing recurrences in the next survey I go over. So I don't know how else to do this. I'm not a very good entertainer or speaker, but there's some great points that he hits here, and they're building towards the normal recommendation. But here goes. He references animal studies that show that fixations of joints, spinal joints, they're there for 4 to 8 weeks, cause degenerative changes in osteophyte, bone spurs, formation on the joint surfaces. So we don't want those fixations to be there long. Definitely not 4 weeks or more. Another point, sadly, these facet joints, these spinal joints, show surface degeneration that begins at less than 1 week. And as a matter of fact, if it goes for 4 weeks, creeps into that 4-week period, there's evidence that there's irreversible degenerative changes, bone spur formation. He goes on to reference studies that show that you'll see a progression from mild adhesions at 4 weeks to moderate adhesions at 8 weeks and severe adhesions at 12 weeks. So I've got folks that do maintenance care. Often they flirt with 6 weeks, 2 months, 3 months, and that has its benefits without a doubt. That's better than getting none. But if subluxation occurs in that time, and you give it that full, 2 or 3 months, you're going to get changes that are not reversible. He makes the point that joint immobilization has been found to cause a time-dependent loss of neurons that become progressively worse thereafter. An increase in neurons occurs after you release that fixation. So we all know once there's actually been nerve injury, that's tough to get over. But if you catch it soon enough and reduce that subluxation, that limited movement, you can see a rebound. When you have a subluxation that's causing immobilization, it also causes time-dependent muscle weakness, atrophy, and fatty deposition in the multifidi muscles, which are intrinsic, deep, important, stabilizing muscles of the spine. The time-dependent factor progresses from normal to mild to moderate to severe atrophy of the muscles. Now, there are studies that say there's also the possibility of a reversal of neuronal degeneration and muscle weakness if you get adjustments and unstick those joints, remobilize them. So he makes a statement that evidence clearly demonstrates that the clinical consensus of the dosage of maintenance manipulative therapy, maintenance care, has been found to be most beneficial at an average of once every 2 to 4 weeks, because you're catching it, you're getting ahead of any of those changes. We also see here that it closely correlates with the studies that show an onset of the degeneration of those joints and the neural degeneration and the muscle weakness. So on average, the best frequency is 2 to 4 a month. I mean, not 2 to 4 a month, an adjustment every 2 weeks, or up to once a month. Hopefully that made sense. So manipulative therapy adjustments retards the progression of adhesion formation, joint degeneration, neuronal changes, and the changes in muscle strength and recruitment patterns, which would be changes in posture. This could result in improved function, decreased episodes of injuries, and improved sense of well-being. He makes special note of a 2004 chiropractic study of chronic low back pain that showed that the group of patients who received 9 months of maintenance care or wellness care at a frequency of once every 3 weeks completely maintained their initial improvement, while the control group dropped back to their previous state. So a lot like dental care, a lot like anything in health, if you go to the gym and make gains and you stop going to the gym, you're going to lose them. So if there's damage done to your spine through subluxations, through trauma, through wear and tear, and then you work to get it restored and you stop, just like everything else in health and life, it's going to lose ground. But this shows very clearly that maintenance care and wellness care or supportive care is going to prevent those relapses and help you maintain. So in the end, there's a common thread of time dependency noted in all the laboratory and clinical studies. The period of onset of the anatomical and physiological changes range from 2 to 4 weeks. So if you're getting your wellness adjustments every 2 weeks, you're going to stay well ahead of that. If you got a great spine that didn't have much damage or change or degeneration before you came into the office, once a month will probably work. So, I think I've been at this a while. Yeah, this has been too long. I'm going to go ahead and end this one, and I'll cover the next study for the next Thursday thoughts. Hope this was interesting to you. Stay tuned.